Hello, my name's Angela Dixon. I'm one of the advanced nurse practitioners and I'm also the spirometry lead at the Maya Medical Centre. What I wanted to do with you today was to do a short teaching webinar around the use of your SABA or blue inhaler or reliever inhaler, whatever you might know it as. So the purpose of this webinar is to provide education around this, when it should be used, what it should be used for, and an update of the national guidelines. So you might find that you've been given a blue inhaler for your condition of asthma or COPD, or possibly another underlying respiratory condition. National guidelines have changed recently, and the most current guidance issued for both management of asthma and COPD suggests that the blue inhaler should not be used more than 3 times a week. Any use of this in excess of 3 times a week can lead to ongoing respiratory problems and indicate a mismanagement of your condition. So it can lead to increased exacerbations, chest infections, increased hospital admissions, and increased A&E attendances. Overuse of the blue inhaler will also increase hyperresponsiveness of the airways. And if you've got an underlying condition like asthma or COPD and your airways have got a degree of hyperresponsiveness anyway, that's the last thing we want to be doing with you. Okay, so what I'm trying to do in this webinar is to get a message across that you should only be using your blue inhaler when you need to. And if you get into the stage where you're using it more than 3 times a day, every single day, then we've quite clearly got a problem. Certainly, as I said just a few minutes ago, the national guidance currently indicates that they should only be used 2 or 3 times a week. And gold standard asthma management indicates that they shouldn't be used at all, and you should be reliant on your inhaled corticosteroid or your combined background inhaler, your preventer inhaler. So a recent text message was sent out by myself and Chris Hill, our clinical pharmacist, advising that blue inhalers were no longer going to be put on repeat dispense prescription. Now, this in no way, shape, or form means that you are not going to be allowed to order a blue inhaler. All that means is that in light of the recent guidelines, it's kind of an internal audit measure for us at the service, at the surgery. What we have noticed historically is that patients are consistently over ordering their inhaler. Now that's understandable to a certain degree. Some people want one for the car, some people want one for upstairs, some people want one for downstairs. If you're a child and you're the child's parent, you might want one for home, and you might want one for school. But remember, it's a portable little device. It's perfectly easy to be able to be popped into your handbag or a pocket and carried around with you when you go out. So there's no need, in essence, to have one for every single room in the house. Okay. Going back to the original text message, when that message was first sent out, there was a little bit of lack of clarity around it, and some patients were actually concerned that they were never going to be able to order a blue inhaler again. I just want to reassure you in this webinar that this is absolutely not the case. We're not saying by any way, shape, or form that you're never going to be allowed to have a blue inhaler again. What we are asking is if you get into the stage where you feel you need to order more than 2 or 3 inhalers a year, or you're finding that you're using it more than 2 or 3 times a week, then that should ring alarm bells for you as a patient, and it certainly rings alarm bells for us as a practice that we might need to step up your management. So, obviously, if you get an acute chest infection and you become acutely unwell and you feel feverish and you're having to use your blue inhaler a lot more than you normally would, then clearly that might very well be an indication that something is going wrong and you have an acute chest infection or you're having an exacerbation of your COPD and your asthma. And if that's the case, we would expect the management to change in that scenario, and we would expect you to be using your inhaler more than the recommended 4 puffs a day. And that would be perfectly acceptable in the shorter term, because as I say, we are recognising that you're stepping up your treatment. But once you've contacted the surgery and you've made an appointment to see myself or one of my AMP colleagues, and we've listened to your chest, and perhaps we've given you some inhaled steroids, perhaps a course of oral steroids or a course of oral antibiotics, then we would expect you to step back down the use of that blue inhaler. So going back onto regular management and regular use of your blue inhaler. If you have asthma, you should have been given a background brown inhaler. You might know it as Clenil, or you may also have given one of the MART inhalers. Now, MART stands for Maintenance and Reliever Therapy, and the two inhaler devices that we have as part of the MART regime are Symbicort and Foster. Now, both those can be used as a maintenance dose twice daily, every day, in the background as your preventer. Okay? If you have a background condition of COPD, you might have been given something like an oral ellipta or Spyalta, or one of the other longer-acting bronchodilators, or also a longer-acting muscarinic antagonist. Okay, so that should be your routine maintenance kind of treatment. But as I say, if you do feel that you have an acute chest infection, by all means make an appointment to come and see us, and we will address that for you straight away. Now, when you're using your blue inhaler, it's very easy to check when it's empty. If you have a device like an AccuHaler or some of the dry powder inhalers, especially if you get like Foster and Symbicort, they will have on the back of them a dose counter. So it usually starts off at like perhaps 100, 120 doses, and each time you actuate the inhaler, it will go down one. And when you get down to about 10 doses, we recommend that you phone up and get a new prescription for that inhaler. Okay, so just to remember, if you're asthmatic, the Foster or the Symbicort or the brown inhaled corticosteroid Clenil, they are your background preventer medications. If you are a COPD patient, you might have something like an oral ellipta or Incruse or Spyalta. If your reliever inhaler is like mine here and is like an MDI, you might think to yourself, well, how am I going to know if it's empty? So it's quite easy to check that. Don't be afraid of it. So I have it here, yeah? So you can just get hold of it, pull the canister out at the top, give the canister a shake. If the canister feels quite full and you can hear the solution rattling about inside, then obviously you're aware that you've got a good few doses left in it yet. If you feel that it's quite light, then that probably be an indicator to you that you need to replace it. So phone up, ask for a new blue inhaler, and then you'll be able to start using it again as soon as you get it. To replace the canister, all you do is slot it back in its plastic casing, pop it down, and then it's ready to go. Okay. Now, when you do feel that you are ready for reordering a blue inhaler, sometimes you may very well get questions over why you need to use it. And as I said earlier in the webinar, that is not because we don't want you to use it. It's more of an internal audit measure for us to see, are you acutely unwell at the moment? Do we need you to give you some oral steroids or oral antibiotics? Perhaps you want to come into surgery for appointments, so myself or one of my colleagues can have a listen to your chest. Or if things are that bad, unfortunately, sometimes when we see you, we might have to send you up to the road to the hospital. But clearly, we can't determine that if we keep giving you these blue inhalers on a repeat prescription. So just to reiterate, you will never be in a scenario where you are not allowed to have a blue inhaler. Yeah, you might be asked to come in for a review, but if you need one desperately, you will always be given one. Okay, so just to summarise, your blue inhaler or your SABA should not be used more than 2 or 3 times a week. It should not be used in isolation for either the management of asthma or COPD. And this is in line with current guidance from NICE and GINA and the British Thoracic Society and the Scottish Intercollegiate Network. Okay, so 2 to 3 times a week. If you feel acutely unwell, come into surgery, get checked over. If not, and you're just ordering it on a repeat basis, then by all means make an appointment to come in to see one of my practice nurse colleagues, and they will be able to do your asthma and COPD review with you. And finally, I'll just leave you with one final thought. I like to use the analogy of a leaky roof with the SABA, the blue inhaler, the Ventolin. So if you had a roof that was leaking, you have two options for the management of that. You either pop a bucket under it to collect the drip, so that's a quick fix solution, which will be the blue inhaler, or you would get a plumber out and get the job repaired properly, which would be the gold standard solution. And I liken that to the kind of background inhalers, so the steroids or the Fosters and the Symbicorts of this world. Okay, I am more than happy to talk to people about inhalers on a one-to-one basis. So if you go for your routine asthma or COPD checkup with any of the practice nurses, they're all perfectly capable of giving you information about asthma inhaler use and talk to you about the local guidelines. But if anybody wants specifically to speak to me or has any ongoing concerns about the message that was sent out by myself and Chris, please don't hesitate to contact the surgery. I work most days, and if you phone up and ask reception to put you through to speak to me, they will do so. Thank you very much for listening, and I do hope that you found this presentation useful. Thank you.